Relax and rotate. There we go, D. Relax and rotate. Good. All right, we're getting some good movement those upper thoracics. And create separation in the joint. So we're going to again use the table. We're going to drive right into the low back. Setting the tension just right for D. There we go. Good. Hey everybody, Dr. Luke Stringer here, Advanced Health Chiropractic down in South Chicago, and we're here with one of our favorite patients, D. D is about halfway through the first phase of her corrective care. And D, if you could tell all the viewers and people watching, what was the main reason you came in, any second, tertiary reasons you came in, how'd you found us, how you been feeling after the first 2 or 3 weeks of treatment?
Nice, yeah, I can answer all of that. I came in for scoliosis. I am curved in the back, which is kind of good, kind of bad, right? But I found this place on Google, fine. You know, you do the searches and you look at the reviews, and they have some awesome reviews. So I chose to come here, and I am feeling the halfway mark of better, believe it or not. We come in, we do the adjustments, we do some stretching and some working out a little bit to make sure the body is subluxated.
Less subluxated, you got it, D.
Less subluxated, okay, what you said. And it's working, so this is a great place to be, but a great place to come. Come on in so you can get uncurved.
There you go.
Yeah.
Yeah, so appreciate that, D. D came in predominantly with low back pain, scoliosis, a condition of the spine where when you look at the spine from the front should grow straight up or should be straight up. D's kind of got some S curves in her spine. That also creates a lot of stress and tension in the musculature and the joints in the low back. It's been going on since adolescence. And obviously with that, we're getting a lot of upper back, mid back, some neck pain. Obviously it just affects how D functions. Goals for D, are we able to sleep through the night without any pain? How's your sleep cycle been going?
I'm sleeping so much better. I must say that I am actually able to sleep on my left side, and that's where the problem was.
Awesome.
And that's my favorite side. So,
awesome.
yeah.
Me too. So Dee's already sleeping better. She's about a quarter of the way through her treatment. Yeah. Dee's about to, when she leaves the office, to leave us a Google review to sort of telling everyone this, awesome, so they can find us. Okay, Dee, let's get your spine adjusted. Alright guys, so if you've watched our videos before, we like to use the orthostim. This is a piece of equipment that puts movement into the spine. When the spine communicates to the brain, pardon me, when the spine moves, it communicates to the brain. 80% of stimulation. Also helps hydrate discs and fires up the postural muscles in the spine. You see us using this instrument a little bit. It's called the activator. We use this for pediatrics, geriatrics, or patients like D who have some really big shifts in the spine. We're going to adjust C3. This innervates the neck, contributes to neck pain. C4. That can contribute to the neck and upper back pain. C5. So that looks really subtle, but it delivers over 60 pounds of pressure per square inch. We're then going to adjust these upper thoracic spine. You can just feel as you palpate. That's where one of the scoliotic curves is. So we're going to adjust right into that. Nice job, D. Then into this mid-cervical or thoracic spine. Well done. Going to create a little bit of rotation up top. Relax and rotate. There we go, D. Relax and rotate. Good. All right, we're getting some good movement those upper thoracics. We're going to adjust both the left and the SI joint. You can see D's hip likes to shift up here. It's obviously contributed from scoliosis. I'm going to drop right into what we call that sacroiliac joint. So the hips and sacrum come together and they move. The side joint function is important for gait function. You see after we remeasure those legs, D's in alignment, still got a little shift in this left hip. So D, keep your right leg straight, raise it up, down, left side, down. You can see it's a lot easier for D to move a right leg than a left. So we've got some rotation going on in the tailbone. We're going to adjust that. I'm going to go right through the apex or the ala of the sacrum here. Nice job, D. Then, obviously, gravity compresses the spine. The spine is curved so we can absorb gravity. So this is called flexion distraction, and this opens up the spine and creates separation of the joint. So this really helps open up the joint, decompresses the spine. Good. We're now going to do a little bit more work in the low back. Okay, these in phase one. Phase one treatment for us, kind of the crawl phase. We're going to manually adjust this spine from the get-go. He's going to get sore. Phase two, we'll look at getting into that manual adjustment. We're going to again use the table. We're going to drive right into the low back. There we go, D. And we're going to come right into all three. Setting the tension just right for D. There we go. Good. All right, D, awesome adjustment.
Beautiful, that was good.
Yes, ma'am. Sit on up. Alrighty, guys, if you're watching on YouTube, subscribe, turn on the notification bell. If it's Instagram, Facebook, like, follow the page. Appreciate you watching. We'll see you for some more content soon. Thank you, D.